This is your advocacy update from the Rojas Report. No fluff, no filters, no fake reform. Let's kick it off with the CDC. The White House is reportedly considering former Congressman Michael Burgess to lead the Centers for Disease Control and Prevention. Burgess is a friend. He's a Republican, an OBGYN, and longtime member of the House Energy and Commerce Health Subcommittee. This would be a huge shift. An actual physician leading the CDC, not just a political appointee, and one who actually understands the pressures physicians face. Pretty great. The last nominee, unfortunately, was quietly pulled. Burgess is now the front runner, although I haven't heard anything in the last 24 hours. We'll see because no final decisions have been made. This is one to watch. Now let's talk my favorite topic, physician-owned hospitals. A bipartisan group of lawmakers has reintroduced HR 2191, the Physician-Led Rural Access to Quality Care Act. This is important. It's backed by Representatives Morgan Griffith, Kevin Hern, Vicente Gonzalez, John Joyce, and Lou Correa, alongside a growing list of co-sponsors. This bill would lift the federal ban on new physician-owned hospitals. That's a ban that's been in place since the passing of the Affordable Care Act. It never had anything to do with quality. It was always about protecting the large health systems and reducing the number of hospitals where Americans could go for care. PHA President Dr. Joseph Edelhoff said it best: the need for physician-led hospitals isn't a debate. It's a solution whose time has come. He's right. He's been right for a long time. He's one of the best docs in the country. Rural communities cannot wait for new hospital towers. Patients need access today, and physicians are ready to lead, especially in rural America. Let's hope Congress finally lets them. And now, IDR under the No Surprises Act. Here's what just dropped from CMS. We've got an 84% win rate for physicians, hospitals, and air ambulances. We've got an 85% of winning offers that were higher than the insurer's original payment. IDR disputes are up 55% year over year, and carriers are still gaming the system. They delay the resolutions by challenging basic claim eligibility. We're going to call it what it is. Carriers are losing because when a neutral third party gets involved, fair payment wins. And despite 4 federal court rulings against their tactics, carriers are still trying to manipulate the process. I don't know how you people work for these people. Here's the truth. IDR is working because we're fighting back. And we're winning the majority of the time. This isn't just a legal battle. It's a signal that physicians and facilities are done playing defense. So that's your Rojas Report advocacy update. This is one of my favorite segments. A clinician possibly leading the CDC, a bipartisan push to bring back physician-owned hospitals, the very best, and a data-driven takedown of insurer gamemanship in the IDR process. And that's just 1 week. We're not waiting for permission. We're building. All right, we'll be right back. FICAP Fund invests with clinical precision. We are the new venture capital for healthcare. At FICAP Fund, we invest in entrepreneurs rethinking care delivery. We invest early in technology that simplifies physician workflows, enhances patient care, and drives operational excellence. Our network of experienced physicians, healthcare professionals, and executives validate innovations in real-world clinical settings. Physicians Capital Fund, investing in healthcare simplified. To invest, email info@ficap.com.